Welcome, folks. We are going to get started here in just a sec once we get everybody in from the waiting room. All right, looks like we are good. So welcome, everyone. I am Dr. Eric Russ, Executive Director of the Kentucky Psychological Foundation, which focuses on bringing trusted mental health information to the public. We co-host these webinars with Mental Health America Kentucky, and Hannah Brosnan, their Executive Director, is on with us today. We are happy to bring this webinar series to you all where we bring mental health experts to provide education and resources about a variety of mental health topics. We are excited to bring this one to you today. I am really excited about today's workshop and pleased to introduce our speaker today. I got to know Dr. Badour a bit when I worked in Lexington, and we're really fortunate to have her knowledge and expertise with us. So Dr. Christal Badour is a licensed clinical psychologist and associate professor of psychology at the University of Kentucky and founder of Science for Survivors, a public education, therapy, and consulting initiative that translates trauma research into accessible tools for healing. Clinically, she specializes in evidence-based trauma therapy and forensic assessment. She also provides training and consultation to community organizations, legal professionals, and healthcare providers. Through Science for Survivors and her public outreach work, Dr. Badour is committed to helping people understand trauma in clear, compassionate, and empowering ways that honor individuals' diverse experiences. Again, we're really excited to have her here today, and I'll turn things over to Dr. Badour to get us started.
Thank you so much for that kind introduction, Eric. I'm really excited to be here today to share a little bit about what the science tells us about healing after trauma. I like to think about this as a little bit of like a trauma 101, if you will. And I want to talk a bit about what we understand regarding why people have the kinds of reactions that they have after trauma and what we know about how we can help. And I've tried to save some time in here for some conversation and questions at the end. Hopefully we'll have a nice chat today. So I want to start with this idea of will I ever feel like myself again? I feel like this is one of the most common questions that I hear from survivors of trauma who may be feeling like their life has changed in ways that they don't see ever getting back. People talk a lot about challenges of why can't I just feel better? Why am I so jumpy? Why do I keep feeling this way? And is there any hope for the future? And I hope that our conversation today helps to clarify a little bit why people experience the types of things that they do after trauma and what we know about how to support that. So we're going to start by talking a little bit about what exactly is trauma and what changes in the brain and the body, and the way that we view ourselves in the world as a result of these types of experiences. And then I'm going to talk a bit about practical tools, things we can actually use to help in recovering from trauma on our own and in our lives outside of the therapy space. But then also to talk a little bit about when is a good time to seek support and how to know when it's a good idea to reach out. And then a question that I actually get a lot is how can I support a loved one who's experienced trauma? We often provide information to people about, when you've experienced trauma directly, what kind of support do you need? But we all have people who love us and we all know people who've been impacted by trauma. So that's another piece that I hope to talk about today. I want to spend a minute to just talk a little bit about what I mean when I use the word trauma. Trauma is one of those terms that we hear used quite frequently now. I think we hear it in the news, we hear it on social media very broadly. And we're not always describing the same thing when we use this word. So we know that the language we use is really important. So to make sure we're all on the same page here. So, researchers have a different goal when they're defining trauma than we do in everyday language. And there, what researchers are trying to do is come up with a common description of particularly the types of events that we agree as a research community. Although this is still, an ongoing discussion, but the types of events that we agree can lead to certain reactions that warrant study and treatment development and support in the context of therapy. And so, in that space, the science usually defines traumatic events as events themselves, particular experiences that can involve a variety of different things. Situations that involve life threat to oneself or others, serious injury or the threat of serious injury or harm, any type of sexual violation, and also the loss of someone that we care about, including losses due to violent or accidental situations. But that can be a little bit different than what we talk about in everyday language. When we use the word trauma, we're trying to describe not only our experiences, but the painful and distressing outcomes of those experiences, trying to communicate what can be lasting pain and impact from a wide variety of different types of events. That can include those that scientists describe as traumatic, but may also include other highly stressful or painful experiences. And I want to just say that both of these ways of talking about this really do matter. And it's important that we're clear about how we're thinking about this so that everyone, so that people in the general community, if they hear researchers say, well, only these things count as trauma, that might not really represent their experience. And so as we talk today, what I'm going to do is talk, when I use the word trauma, I'm describing experiences, but then I want to use the term recovery or trauma responses to think about the painful impact that those things can have in people's lives. So, what actually does change when someone experiences traumatic events? One of the things we know is that traumatic events tend to overwhelm the nervous system, at least in the short term. And so, those subsequent survival responses that people have are actually the brain's way of protecting us from future situations that could be dangerous or harmful for us. And when we boil it down to the real purpose of our brain, it's to keep us alive. Our brain is hardwired at its most fundamental and basic to protect us. And so when we talk about trauma, it can be helpful to really think about three large systems in the brain. One is the alarm system. And you may have heard of this structure in the brain called the amygdala. It's a component of our brain's alarm system that's really important in trauma. So, anytime that we detect a potential threat, that alarm system is really going to kick into overdrive with its goal being how can I, oh, sorry. Um, did my slides go away here? They went away on my
No,
side.
we
We
can
can
still
still
see
see
them.
him.
Yeah.
Okay. Well, I've lost them on my side. Goodness. Okay, here we go. Um, okay. I don't know if I'll be advancing them properly since I've lost them. Sorry. This is my tech challenges here. Um, Okay. So we have our alarm system that's really designed to detect that threat. We have our memory system that overall stores our experiences. And there's a particular structure there called the hippocampus, if you've heard that term. And that one's really important for helping us store memories that are really emotionally strong. And then, of course, we have our thinking brain that's really important in helping us day to day interpret and plan things. And when our brain detects a threat, that alarm system really activates immediately. Its job is keep us alive at all possible costs. And then the memory system, when it's laying down memories in that survival mode, they don't always look the same as the memories that we have day to day. They're really flooded. The brain is flooded with stress hormones that are associated with our alert system, and that really changes the way that the memory system makes sense of things. So instead of storing kind of an organized narrative like a video that might play in your mind when you think about the day, it is often storing things that are strong, kind of sensory snapshots, sounds, smells, images, bodily sensations. And that happens because of those chemicals that are being released during that threat that's prioritizing keeping us alive. It's telling our brain, like, remember this in great detail because we may really need it to stay alive later. And while that's happening, that thinking part of our brain, the part that we normally use to help us plan and reason and organize, it kind of takes the back seat while that more animal, kind of deeply wired survival system really takes over. So, what happens during trauma and how that memory is stored afterwards is really not very typical. And that's why our trauma memories can feel really different from other memories that we might usually have. Okay, so now the real question is, can I take my slide forward now that I've messed it up? Let's see. Sorry, bear with me here. Um, This is a wonderful question I'm seeing popped up while I'm trying to address this is how do we take ourselves out of that survival situation, especially if we've been in it for a long time due to childhood that occurred or trauma that may have occurred early in childhood or may have occurred repeatedly. And that's something that I hope to have good time for us to discuss today. Let's see. Sorry, I don't know what's happening. I'm gonna just stop my share for a moment and fix my slides because I don't know what happened. Thank you for bearing with me here. Okay, now I've got it. Okay, I think we're back. Does that look right?
Looks great.
Okay, thank you. All right. So, what actually happens after trauma is that for some people, that alarm system can get stuck and stay on. And I want to refer back to the question that we received there about, well, what happens when it gets stuck in the system, perhaps due to repeated trauma or due to the impact of a single trauma that may just really kind of keep that alarm system on. So, first, let's talk a little bit about what that looks like when we get stuck in that survival mode. It's really common that people describe this feeling of sort of always being on edge, always looking out for potential danger and threat, even when you're trying to relax. And that can look things like having racing thoughts or being irritable or jumpy. It's hard to focus. You just really can't relax, can't calm down, and can't bring your body to put itself in a sensitive state for things like sleep. And that can be really challenging and really taxing on the body and the brain over time, especially when this alarm system can stay on for months or years into the future. The other thing that we see happens is that that memory system that I mentioned that during a trauma is laying down memories in a different way than it does typically, that memory system can also get stuck working in overdrive. And after a trauma, we know that the brain tends to struggle to file that experience as over, as something that actually happened in the past. And that's part of why the brain can keep trying to bring it up and trying to process it and make sense of what happened and help to prevent potential threat from impacting us negatively in the future. And that's why trauma memories sometimes can feel like they're in the present and not in the past. And that's because, again, our brain is actually trying to protect us. It's working really hard to understand and make sense of what happened. However, that can be really distressing when we're not sure how to make sense of that overdrive memory system. And then a third thing can happen is that sometimes that system actually starts to go into shutdown mode. What we know is that when our nervous system is overwhelmed, particularly for a long time, like if we've been stuck in that alert system for too long, our nervous system can actually shift into a shutdown mode to protect us. And in some cases, we see that when that happens, a lot of things that feel very outside of our control, because they are, we might start to feel numb or disconnected either from our surroundings or even from our own body. We can feel detached from other people, feel withdrawn. Things can seem kind of foggy or unreal or unclear to us. And that's all our brain's way of telling us that this is too much. I need to step back and help you calm down and bring down that over alert system. And in addition to these systems, we also see that over time, as these are continuing to be so activated in that sort of survival mode, if you will, is that trauma can actually change the meaning of our life as well. It can shift the way that we see ourselves, that we see other people, that we see the world, the ways we see our future, and the hopefulness we have for it, and can also make real changes in our view regarding our purpose, the meaning of our lives, and in some cases, our faith. And in many cases, these shifts can come with very powerful emotions, especially feelings of guilt and shame that can stick around for many years, even if the trauma was not someone's fault. So, if you might be thinking about some of these things and recognizing perhaps these are things that I have felt, or I know loved ones in my life who felt these things, well, you can imagine how it can be really difficult to stay in a constant state of threat like that. And we do things to try to keep going. These strategies that we engage in to help us keep going in spite the challenges that we're facing as part of our trauma recovery make a lot of sense. They're necessary to help us to continue to function in our lives. So some of the things that we might do to help try to keep us going are avoiding reminders, especially if that memory system is really on alert, trying to bring back those memories in response to triggers or things that make us think about the trauma. Then we might start going out of our way not to think about it or not to come into contact with things that could serve as reminders. Many people love to stay busy. Let me dive into work or my home life or other things that can help keep my mind off of these difficult situations. I might intentionally push away the feelings or distract myself. And I talk to many people who get this idea of I'm just going to power through. I'm gonna push through, and in the future, when I have the space, maybe I will sit down and think about these things. So it's true that while these strategies are really essential to help us to continue to function, they also can make it more difficult for our brain to fully process and make sense of what happened so that it can file that memory away as something that actually happened in the past. And for our alert system to determine that actually now that threat has passed and I'm currently safe. So now for the real question of how do we actually get beyond that survival mode? What actually does help? And we know that healing supports those same systems that trauma affects. And so we have to think about healing from that same framework. So I want to start with that arousal system where we started thinking about how trauma impacts us. And to say that in the same way that our brain learns about threat, it has to learn about safety. And there are several things that we can do to start to help calm that overactive nervous system. And if I could wave a magic wand and just have one thing that I could help people with in terms of calming that alert system, it would be sleep. We know that sleep is so, so essential for helping with trauma recovery and helping the brain process those memories. But sleep is one of the things that gets disrupted by trauma, but it's also in our society one of the things that we are sort of last to prioritize, right? Well, I can sleep when I'm dead. That's kind of a common phrase that people use. But in fact, it is so critical for recovery. And so it's hard to make shifts in your sleep, particularly if trauma has impacted it for a long time. But one of the biggest things that you can do on your own is work toward a consistent sleep routine where you're going to sleep. Or getting in bed to go to sleep and waking up and getting out of bed at the same time each day. That is one of the biggest things we know from the science we can do to help with sleep. There are also strategies like slow breathing that can help send signals to your brain that actually this is a safe situation right now that I am in. Movement, we know, is really important, whether that's gentle, gradual movement or exercise. That sends a lot of chemical messages to our brain, reward related information, and also safety related information that can help us to calm that nervous system as well. For some people, meditation is really wonderful to have quiet moments to practice training the brain to stay in the present. Because following trauma, for many people, it keeps going back to the past and can be hard to actually stay in the present moment and remind yourself that right now I actually am safe. We also know that actually spending time in nature, there's been a lot of research on this showing that just spending time in nature as little as 20 minutes can help reduce heart rate and blood pressure, and many of the physical sensations that show that our nervous system is kind of on that higher alert setting. And another piece I like to talk about is taking breaks from threat. We're constantly bombarded with information about stressful news situations, about chaos in our lives, conflict potentially with people in our lives. And sometimes we need to give our nervous system a break so that it can recharge and start to bring that system down. And what we know is that over time, that alarm system does start to quiet when our body repeatedly experiences safety. The other thing that's really important, speaking then to the memory system that goes into overdrive after trauma, is that it's really important for us to get to the point where we can turn toward the memory by choice rather than our brain turning us toward it. And so this looks different for each person. For some people, this might be talking with someone about what happened, whether that's a loved one or a therapist. It might be writing down your thoughts and feelings or the memory of what happened in a journal. It might also be just taking some quiet time when you have the space to feel the emotions that go along with what happened and allowing yourself to do that. But the key here is having the choice to turn toward what happened in your own way and at your own pace, because healing looks different for everyone. The goal here isn't to be thrown back in to what happened. It's to revisit your story in a way that gives your brain what it needs to actually make sense of what happened so that it can start to file that memory away as something that happened in the past rather than feeling like you're still here in the present. And we also talked about that shutdown mode. So, in particular, for many people, when they start to look toward that memory, they can get overwhelmed and they can find that that shutdown mode starts to take over. And so, it's really important, especially if you know that you are someone or someone you love tends to go toward that space of shutting down or checking out or feeling numb when they are approaching memories of what happened. It's also important alongside turning to that memory to have some strategies to help gently reconnect if you notice that that system starts to shut down. And the good thing is that we know that some small sensory experiences can help the brain really reorient to the present moment, especially if we can catch that it's happening early, if we have some tools on the front end so that it doesn't surprise us. So we talk about things like grounding, which may be a term that you've heard. But when we talk about grounding, what we mean is bringing yourself back into the present moment. So it can be as simple as something like I do this exercise with my young son when he experiences anxiety is a 5, 4, 3, 2, 1 exercise. So I have here on the slide, name 5 things you can see, but you can do 4 things you can hear, 3 things you can smell, 2 things you can taste, 1 thing you can touch. That's a great kind of concrete exercise that can help just bring you back to that present. We also know that changes in temperature can be really helpful. So holding an ice cold water bottle in your hand while you're in these difficult situations, or splashing cold water on your face if you find yourself starting to feel that system shutting down. Sometimes drinking warm tea or keeping something warm in your hand can be really helpful as well. Something as simple as pressing your feet firmly on the floor so you can feel that sensation of actually being present in the room. Slow, deliberate movement, standing up and walking around in the space. So, again, you can feel yourself connecting there. Sometimes connection with others can be really helpful. Texting, calling, sitting near someone who feels safe to you. Or even as simple as making eye contact can again help you come out of that memory and into the present moment when your nervous system is getting too overwhelmed. And in these moments when you feel yourself starting to shut down, the goal isn't to force big feelings to be present. It's really to help your system realize, I'm here, I'm safe right now. And once we're feeling safe, then we can start to consider whether we might be ready to turn back at the pace that feels good for us to revisit that memory by choice. And as far as, I talked about the idea that over time, trauma can really shift the way that we see the world and the meaning that we make about it. And an important thing that we find is that over time, trauma can make our world feel smaller because it narrows our goals oftentimes to really one goal, which is stay safe, or and sometimes, keep my family safe or keep others safe. And while that's so important, it's not enough for a meaningful and full life. And so while we find that trauma can really make life small and focused on safety, when we can start to get out of that survival mode, life expands. Um, and so we really want to encourage people to think about, even in times of healing and struggle, to think about staying in touch with your values and actually what are the parts in life that make life worth living. And so you might ask yourself these questions. What kind of person do I want to be? What matters most to me now in my life? And how can I act, even in small ways each day, to be in line with my values, even while I'm working through healing from trauma? Because both those things can happen together. And I want to make this really important point because I think as mental health professionals, we are often really focused on helping people to reduce symptoms. But recovery isn't just about reducing symptoms, it's about reclaiming meaning and working toward a life that feels full. And so, when can support be helpful for you? Well, if you find that some of these strategies on your own you've tried, and you're still finding that your world seems to be getting smaller or staying smaller than you would like, if you're finding that it's hard to function day to day or at night because of sleep, um, and perhaps nightmares or difficulties taking these thoughts out of your mind when you're ready to focus on something else, if you still feel like the past is happening to you now, if you're really feeling pretty disconnected from others and from yourself, if you find that feelings like guilt or shame really do feel pretty persistent and heavy in your day in and day out, especially if you start feeling hopeless about your future, or if you're finding that you're using strategies to help you get through the day that worry you, maybe you find yourself drinking more than you feel comfortable with to help get through the day or to sleep, just in one example. Um, and what I'd say here is that needing support doesn't mean you're failing. It's often a sign that your nervous system has been just carrying too much on its own for too long and might need some additional support and help. So, what can that support look like? Well, it doesn't have to be a one size fits all. Many people, when they think about trauma, they think about PTSD or post traumatic stress disorder. And then they might think about treatments that they've heard of that allow for processing of the trauma, to help them work through that. And that is wonderful and very helpful for some people. But for other people, there might be other strategies that would also be really helpful. So, a therapist might do something like talk with you about how your trauma is affecting you now, help you find strategies to manage stress around trauma, to get through your day to day, help you find ways to calm that nervous system, to help improve your sleep, might help you work through those memories of what's happened in a systematic way so that it feels less overwhelming and a little bit like helps you to be able to tell that story on your own pace and in a way that feels comfortable for you if you feel like you haven't been able to get there on your own. A therapist might also help you to address those feelings of shame or guilt or self-blame that you may not have been able to process with someone else in your life, or to really take a look at yourself. And it may be more focused on your relationships with other people, helping to strengthen your relationships and to build trust. For many people following trauma, it's very difficult to establish trust, because People you may have trusted in the past may have harmed you, and that makes a lot of sense and can require help sometimes to work through. And then in some cases, trauma reactions you may be having may be helped with medication as well. But I really want to emphasize that support should be tailored to what you need at this particular time, not just to a particular diagnosis. And I think that's really important to keep in mind. So I want to talk a little bit about when someone you love experiences trauma. And I get questions a lot about, well, how should I respond if someone I love tells me that something traumatic has happened in their life? And if it could communicate sort of one thing that you could maybe take away from this is that the most important thing is that loved ones feel like they're safe with you, that they're believed by you, that this happened, and that they're in control of what happens next. Um, the best thing that you can do is to stay calm, which can be really hard when you learn that something difficult has happened to someone that you love. But it's important to keep in mind that in that moment, when someone's sharing with you, it really should be about how they're feeling more than about how you're feeling. But that being said, it's very important that you also have space to process how you feel and how you're reacting to coping with supporting a loved one or that something difficult has happened to a loved one. It's just also really important to think about when is the right space for that. Believe them. Particularly, this is a space I work a lot with survivors of sexual trauma, and we know from the science and working clinically with survivors that a very common reason that survivors don't share that they've experienced trauma is because they're afraid of not being believed. And so that is so important. Also, thanking someone for telling their story, for sharing what they're comfortable sharing. And it's very normal and typical to want to know more so that you can help and support. It's really important that when someone shares, to recognize that they might not be ready to share more and to avoid pressing for details and just letting them know that you're here for them and to talk about it as little or as much as they want and to let them decide what's going to happen next. I talk with a lot of very well-intentioned people who, when someone we love is hurting, we often want to jump into problem-solving mode. But problem solving often isn't actually what someone needs when they first disclose about a trauma. Sometimes we say things because we want to fix it or make it better, but that might actually unintentionally cause some harm. So when we say things like, "Why didn't you do this?" And that sort of suggests that maybe it was their fault or they could have chosen a different scenario to have a different outcome. Are you sure? That kind of gets at the question about believing someone's experience and validating that what happened to them is real. Well, a lot of times people will say things like, well, at least this worst thing didn't happen. And while that's intended very positively, it can have the effect of making someone feel like what happened to them actually wasn't as bad as they're feeling that it was, and that's not what we want to do. We want to try to avoid saying things like, you should report this, because we want it to be their choice if that's something that they are comfortable with. Everything happens for a reason is a very common thing that people will say. And similarly, people of faith might often say God has a plan. And for some people, that may feel very validating, and for others, that might feel really painful. And so, I'll talk about some alternatives that might be helpful when someone discloses. And the last thing I would say is a common thing that I hear is, well, when blank happened to me, this is how I reacted. And so again, we want to try to make it about our loved one, that this is their experience and not necessarily try to compare to one of our own or an experience that someone else has had so that it can really be about them. So what can you say in that moment? Well, things like, I'm really glad that you shared this with me. Thank you for telling me. That shouldn't have happened to you. I'm sorry that this happened to you. You didn't deserve this to happen, and I'm here for you. And here for you can look really different. It can look like, I'm here for you if you need to get out and be distracted. I'm here for you if you need to sit on the floor and cry. You know, and people need different things at different times. And so a really important thing too is that I'm here for you doesn't just mean right in this moment, it means through the ups and downs. And it can be really stressful and can feel kind of overwhelming in some cases to think about, am I saying the right things to support my loved one? And the important message I'd like to give here, I know I've suggested some specific things you can do to support, but bigger than specific things you can say is that you don't need to be someone's therapist. And that's typically not what they're coming to you for, but they're looking for someone to be steady and safe and someone that they can trust with this experience. And support, of course, isn't just one moment, it evolves over time. And so the best of your ability, how can you support a loved one over time is being consistent and predictable in your responses, checking in gently on how they're doing without pressure. Some people would prefer not for you to talk about it after the initial discussion. And sometimes people would prefer for you to ask how they're doing. And so trying to navigate that about what's the best way that I can check in on how you're doing without pressure, and respect their changing needs and evolving needs over time. Invite opportunities for connection in small, low pressure ways. The showing up continuing to show up, even when sometimes people say no frequently because they're struggling. And we miss the mark, we miss the mark with loved ones, and occasionally we miss the mark as therapists. And that's okay. When we do, the important thing is that we acknowledge it and we try to repair that and ask, what do you need? How can I better support you in the future? And it can be helpful to encourage outside support if it seems like that someone you love might really need that. And then a big piece is taking care of your own well-being. It can take a toll on you to love and support someone who's recovering from trauma. And so you need support as well so that you can continue to show up in your very best ways. And again, that steady, sort of flexible presence and support matters more than coming up with the perfect words. So what kind of resources and support do exist? I want to make sure before I stop and really spend some time to discuss these topics in more detail and answer questions, is just to give some actual kind of concrete supports here. So if anyone is ever in need of immediate support, I want to mention the 988 hotline number, which is a national support hotline that's available 24 hours a day. And if anyone is ever in immediate danger, of course, calling local 911. There are really wonderful resources that are available for trauma recovery that you can access on your own, particularly for families. The National Child Traumatic Stress Network is a wonderful resource. They have great information for people in the community about how do you talk to kids and families about trauma. The National Center for PTSD has a lot of materials that were developed for veterans, which can be helpful. Actually, not only for veterans, they have a lot of resources and information about treatment of PTSD in particular that's publicly available on their website. So if that's something that's relevant to you, you could definitely check that out. And then there are it can be very hard to find the right therapist. So I want to mention, like, if you're thinking about professional help, how do you find the right match for you? There are several therapist directories that you can take a look at. So istss.org has a therapist directory. That's the International Society for Traumatic Stress Studies. So these are professionals who all have expertise in trauma. emdria.org is eye movement desensitization and reprocessing therapy, which is a treatment for PTSD. They have trained providers there on their website. TFCBT, trauma focused CBT, is a treatment approach for youth who are struggling with trauma recovery. And they have a number of therapy providers on their list as well around the country. And then CPT for PTSD.org. CPT or cognitive processing therapy is a well-established treatment for PTSD, and they have a whole list of providers as well. So those are some trauma-specific options. And then you can also search on things like Psychology Today or the KPA, or if you happen to be joining us from outside of Kentucky, your local state psychological services organization have provider locators as well, where you can find a therapist who specializes in trauma. And then lastly, if you have questions after our presentation today or would like to find more information or talk with me after, you can visit my website at scienceforsurvivors.com. And you can also email me at drbadour@scienceforsurvivors.com. So before I open up for discussion, I'd like to just end here by saying, if you were to take away one thing from some of the conversation today, I hope what you'll take away is that nothing about your trauma responses mean that you are broken. They mean that your system was doing what it's supposed to do to try to survive. And those systems that learned how to survive can also learn safety. And because we know that, we also know that healing is possible and there are resources out there to help. So I'm going to go ahead and stop with the formal presentation now so I can leave time for conversation.
That was really great. Thanks again, Dr. Badour, for that. If folks want to put
Yeah.
questions, comments in the chat, we'll get through those and get those to Dr. Badour. Um, Maybe start with that the first question that was in there and a little bit on sort of how trauma that happens early in life might affect people differently or the same and how to think about that.
Definitely. Definitely. Yes. So the question was, how can we bring ourselves out of the situation if we're suffering from long childhood trauma and we become more sensitive or reactive to um, absorb other people's uh, negativity or behaviors? And what I'd like to say about that is that, you know, when we're small, we learn, as we're growing up, we learn a lot of really important things about how the world works, how relationships with other people work, how to interact with others, um, what our healthy relationships look like. And that is it is can be difficult if the experiences you had in childhood didn't weren't able to lay a strong foundation for feeling safe and navigating relationships. It makes a lot of sense why that can be really hard to do as an adult. And so, if you're finding that that is a challenge for you, sometimes it can be really helpful to work with a professional to help kind of manage some of those skills that how to navigate relationships, how to recognize whether a relationship can be healthy or not, how to practice feeling comfortable and safe to express what your needs look like. And we find that for many people who've experienced trauma early in childhood, I talked about that kind of shutdown system that tends to kick in when we're feeling maybe overwhelmed. And that's more likely to happen for people who've experienced early childhood trauma or repeated trauma, where that alert system has been going for a very long time. And so sometimes some of those additional skills to help navigate that can be really, really helpful for people, particularly who've experienced childhood trauma. Okay, let's see. Another question about what about situations where the person was under the influence of substances, and the trauma involves memories of hallucinated evil images? That's a good question. So I'm not as sure. I'd have to learn like a little bit more about that particular situation, I think, to give specific advice there. But what I would say about, let me just step back and ask about what if someone had been under the influence of substances during their trauma, because that's a fairly common situation. We know, for example, that when people are using alcohol, that they may be more likely to experience various types of violence as well. And we can definitely talk more about why that is. It's not because someone's using alcohol. There's a lot of complicated factors that go on with that. Um, and what we know following that is that one is that memories look a lot different, right? Because if you are intoxicated, the way that your brain's processing memories and making sense of it looks really different. And so that can be a piece that we have to help work through, as that memory system still tries to make sense of what happened, but it just might not be as clear for someone who had been intoxicated. Another piece that happens is that people might have more feelings of shame and guilt and feel like it was their fault that it happened because, say, they had been drinking or they had been using drugs. And what I would say about that, I cannot say this more strongly, is that you should be able to drink and you should be able to use drugs, and no one should ever harm you. And in fact, if you're ever experiencing intoxication to the point that you need assistance, someone should help you rather than harm you. And so I like that. To me, that's such a strong foundation. And so if substances was part of the picture around what happened when you experience trauma, that's something that a therapist can definitely help you work through and make sense of um, how to address that. Any other questions or thoughts?
Maybe one other thing you could talk about for just a minute is I thought you did a great job at the end talking about some different resources for
Yeah.
sort of how to know if something is helpful or how to know, if a therapy
Mm,
is helpful or
yeah.
not and how to think through some of those things.
Oh, what a wonderful question. Well, I think this is so important right now because, at the beginning of the presentation, I talked about how trauma is something that everyone is talking about in lots of different settings. And in particular, I think there's a lot of discussion about trauma recovery and options on like social media, that type of thing. And there are some really great resources. And then there are some resources that really don't have any evidence that's grounded in science. Now, just because something hasn't been rigorously tested in research studies doesn't mean that it won't work. But um, if you have sort of one option, right? Many people are only going to seek therapy one time. And if you're looking for help, you want to know like what's the best option that's most likely to help me. Um, what you can really look at, that's part of why I sent over that list of resources today of some different websites so that you can find like what are good, credible resources there. What types of therapies should I be asking about? What type of therapist should I be asking for? But the other thing I would say in terms of how can I know if maybe what people are talking about might not be helpful for me, because I think that's just as important. One of the big things I see is that anytime you see someone sort of over-promising, I think that is a sign that that might not be the best resource potentially. Um, because just like in all sort of wellness spaces, people have solutions that are going to fix the problem, feel better in 10 days, like that kind of thing. And I think while healing absolutely can happen and doesn't have to be, you can see improvement. We know from the science in a fairly short period of time from a variety of different difficulties and symptoms. It's not going to be an overnight thing. Recovery from trauma is hard. And so if you see people promising the world or hearing things that say, this thing can fix everything, that's a place where you might be a little bit suspicious and you might want to look around a little bit to see, does this seem really credible or does this have any research to really support that this is something that could be useful for me?
Great. All right. Well, one last call for questions in the chat. And if not, folks in the chat can see I put the links to some of those resources that Dr. Badour mentioned at the end, including her Science for Survivors website, so you all can reach out. And really appreciate everybody being here and being with us. And again, on behalf of the Kentucky Psychological Foundation and Mental Health America Kentucky, we're really happy to have you here today. So thanks, Dr.
Thanks
Badour.
so much for having me.
Thanks, everybody. Mm.
Thank you so much.